Good morning to all. Myself T. Prabhu, Assistant Professor, SNS College of Pharmacy and Health Science, Coimbatore. Today we are discussing about sepsis. Sepsis is a severe and potentially life-threatening condition that occurs when the body response to infection become dysregulated. It's leading to widespread inflammation and organ dysfunction. The immune system reaction to an infection can trigger a cascade of events that result in changes to blood flow, clotting, and release of pro-inflammatory molecules. What are the symptoms of sepsis? Sepsis can include a fever, chills, rapid heart rate, rapid breathing, low BP, and altering of mental status. It is an medical emergency that can require immediate attention. What are the causes of sepsis? The sepsis may be a bacterial infections or viral infections to the parasite infections, commonly a source of pneumonia, UTI, or abdominal infections and bloodstream infections. Next, diagnosis. Diagnosis involves the clinical assessment, blood test, and other laboratory tests and X-ray to identify the source of infections and assess the severity of organ dysfunction. So, what are the treatment of sepsis? The treatment, aggressive treatment of crucial. This is often including the antibiotic to target the underlying of infections to the IV fluids and to maintain BP and to the supportive measures of such as vasopressors and oxygen therapy like broad spectrum antibiotics mainly have to provide them for the clinical studies. So what are the complications of sepsis? Sepsis can lead to severe complications including septic shock, acute respiratory distress, and multiple organ failure. The long term consequence can also include the post sepsis syndrome, which may involve persistent physical and cognitive impairment. So, what are the prevention of sepsis? To preventing the infections through the vaccination, good hygienic practices, and promote the treatment of infections can help to reduce the risk of sepsis. Sepsis mainly a significance of global health challenge and ongoing research aim to improve early detection, treatment strategies, and long-term outcome for individual affected by these conditions. To the extensively the infections treated with many other vaccination like pneumonia or polymyelitis vaccination to be provided. It can be regulate the sepsis infections to be avoided. Then, like antibiotics, broad spectrum of antibiotics, streptomycin and neomycin for the IV antibiotic sources to the treatment for the following medical management. There are also including the electrolyte balance and to conveying the IV fluids like oral DNS, EM, EP, IV fluids. They can be support the electrolyte balance. Then also regulate the UTI infections for the further treatment processing to the sepsis. it can be lead to further antibiotics may be 5 days or 10 days to be provided for the patients. The patients are will be taken orally for antibiotics for regularly for 5 to 10 days like azithromycin, metronidazole and clarithromycin and mitomycin. You have to regularly follow for the further management studies. Thank you.